Your grief has a hidden impact on your body, on yourself, both mentally and physically. We often think of grief as emotional, like I miss this person, or I am grieving the loss of an idea, a thing, a person. Grief weighs heavy on us and can manifest in mental and physical symptoms. Emotional and mental are actually different. Emotions are the feelings that we feel. Mental begins to get into the neurobiology and what is actually happening in the brain. Traumatic grief really creates that chaos mentally, and it will impact you physically. I want you to listen as I explore the surprising things that grief can do to our body, both mentally and physically, and give practical tips on how to actually move that pain out of the body so that we can be the healthiest person possible. My name is Cristi Bundukamara. I am a psychiatric nurse practitioner by trade, but I am an expert in traumatic grief because I have studied it extensively as I am going through it. I have lost 3 children and my husband, and not all at the same time. I first lost a son back in 2005, and I did what most people do in traumatic grief. I went on with life and I tried to push through, and I continued to raise my family and focus on my living children. My son was later diagnosed with a rare neurodegenerative condition, which I found out my other daughter Maya and my husband had. And so then it became 20 years of navigating grief and trauma. Grief from all levels, grief of having a special needs child, to grief of actually losing Reggie in 2016, Maya in 2021, and my husband most recently. So I know grief, I know trauma, and I can firsthand talk about this mind-body connection, the grief and trauma, and how to actually move through these things, organize them, and make choices in line with what you want in life. The loss that you have experienced is not what you wanted in life. And unfortunately, we cannot undo those things. And I have tons of videos on grief and how do you actually process grief. But let's talk about this mind-body connection. What is actually happening when you have these physical symptoms? So we know that stress on the body and traumatic grief causes stress. We don't often think of grief causing stress, right? We were taught this 5 stages and you will go through them in a year. And the reality is grief is not in stages. There's actually much better grief theories that you can study. But what I talk about is what happens in traumatic grief. And I think often the grief that we are experiencing is traumatic grief. But what happens is the grief is here and the trauma is here, but they're not separate. They're like this. They're kind of enmeshed together. And we, meaning the world of psychology and psychiatry, have tons of research on how trauma shows up in the body, that it creates a physical response, both hormonal and produces oxidative stress, and begins to change the cells and the function of the body on a physical level. That's what we call mind-body connection. And we know that traumatic things cause this cascade of impact that manifests physically. So what does that mean? Well, it could mean something different for everyone. Oftentimes, we think of grief and emotions as sadness and missing that person. And that is true. And that is, I call it my badge of honor. I will miss my children and my husband for the rest of my life. But when we hold on to the trauma, we begin to think negative thoughts, have anxiety, make choices based on those negative thoughts, and create mental symptoms. And I was even diagnosed with PTSD after losing my third child, right? So I went through years of medical trauma, lost Reggie, and then unexpectedly lost Maya with no medical trauma prior to. She died in her sleep. And about 9-10 months after her death, I was diagnosed with post-traumatic stress disorder. And, I'm working through those things and significant decrease in symptoms. The reason I say that is not normal grief, right? That is that enmeshment of grief and trauma. And it's also a mental health symptom. Things change in your brain. A physical change happens when you are experiencing these symptoms of depression, anxiety, PTSD, or, just that overwhelming chaos. I went and got a scan of my brain as well as a qualitative EEG, and both were abnormal. So, I want you to think about the emotional, longing and missing this person that you've lost is grief. But when you are experiencing depression, anxiety, PTSD symptoms, this is a mental impact of that grief. And it has a physical component, right? Your brain and the neurocircuitry in that brain is a physical part of you, who you are and how you show up in the world and what symptoms you may be experiencing. But then we also have physical. My daughter died about a year before my 50th birthday. And I was really struggling with lots of little symptoms and fatigue. And, is this perimenopause? Is this just getting old? Is this grief? Is it all of the above? Right? So when I say that grief has hidden symptoms, I truly believe that if I wasn't really working on my grief and working on my mental health symptoms, my physical symptoms would have continued to get worse. My physical symptoms 3 years later are significantly improved. And it is because I am working on my grief and trauma. So when I say that there is hidden symptoms of grief, that's what I'm talking about. If it's enmeshed with your trauma and you are holding on to that pain because you are not going to let go of the pain of losing your child, losing your husband, that's okay. I will have the pain of losing my children forever, but I have done significant work on trying to release the trauma, because trauma has a negative impact on you mentally and physically. So what are some of those things that could happen? I was having migraines. So any kind of headache, migraines, and even though there is a kind of clinical differentiation between a tension headache and migraines, and there are predispositions to migraines, and there is a physical component of that, your grief and loss could be exacerbating those symptoms, right? I had ringing in my ear. And we often think about grief as just kind of that knot in your throat, you're having difficulty speaking, or, pain in your chest, you're literally heartbroken, or GI symptoms. But it can honestly be anything. Pain in your joints, general fatigue, insomnia. I was diagnosed with insomnia and sleep apnea. And how can you say how is sleep apnea related to grief? Well, I can tell you. I was just fatigued, right? And obstructive sleep apnea is when your jaw just kind of relaxes and closes off your airway in the night. So mine was very positional, but also having to do with weight. I had slowly, gained weight and just having trouble taking care of myself on a nutritional and exercise way, right? And so that led to a diagnosis of sleep apnea. There is lots of research that connects post-traumatic stress disorder with sleep apnea. You are significantly more likely to be diagnosed with sleep apnea if you have PTSD. Okay, so there is a connection between our mental health and our physical health, and both are biological. Your mental health is biological. So that's why I always separate emotional and mental. So is this normal? Well, I want to normalize it. Like, this is part of the journey of traumatic grief. It absolutely is. But what I don't want you to do is sit in it and say, like, this is my new normal. Because if we allow ourselves to go deep and really heal from this traumatic grief, which is by separating the grief from the trauma, doing things to release the trauma. So when I have a bad day, a bad moment, and maybe I have like a vision, a memory. I haven't had a flashback in a long time, but let's say a flashback, that is like kind of PTSD symptoms, that is negative, that is the trauma, that is not the grief. And so, for example, sometimes when I think about Maya, I'll get a memory of the morning that I found her dead in her bed. And you can see it kind of coming up for me right now. I'll be like, nope. That is not Maya. Maya is the beautiful woman who always complimented every waitress, every woman who came up to her. She would say, oh, you're beautiful. I love your hair. I love your necklace. I love that shirt. And I will shift and I'll still be crying. Like, she was such a beautiful soul, right? And it hurts to miss her, but I'm letting go of the trauma. And I am healing. I am healing mentally and physically. Like I said, I used to have like actual flashbacks or disassociative events, and now it's just memories that I can switch to a positive by doing some of this work. So these physical symptoms that come up, like say headaches, ringing in the ears, maybe chronic infections, throat, ear, nose, throat, respiratory type infections, maybe achy joints, stiff joints, GI problems. I had significant GI problems. I was even diagnosed with what is called SIBO, small intestinal bowel overgrowth, meaning I had too much bacteria in my small intestines, which caused heartburn and ulcers and all kinds of, bloating and discomfort in my GI tract. And I worked with kind of functional medicine doctors and working through some of those things, but also working through the emotional pain and the mental anguish of the trauma, right? And when I say working through, what do I mean? You may need to see a professional counselor. That's okay. Maybe just following my journey and knowing that if I can do it, you can do it, then I am glad that I have empowered you in that. We also have grief intensives and different grief resources. If you are ready to start your grief journey now, please click the link below. Let us have your email address and start this journey of grief. So what can you do? One, you can commit to starting the journey. Maybe you've been on the journey and you just feel stuck. I want you to really think about this trauma versus grief and how do you separate those things. And I want you to take your physical symptoms, whatever physical symptoms you are having, and I want you to reframe them as both the hidden symptoms of grief and whatever medically is going on. You want to go to the doctor, you want to listen to the recommendations of the doctor. But I also want you to realize that if we can decrease the stress, decrease the oxidative stress, allow our bodies to begin healing from the inside out, those physical symptoms should also decrease. So I got a couple questions here. And the first question is, I lost my son about a year ago, and I feel like I'm literally going crazy, like having a nervous breakdown. What do I do? I honestly think that is a normal response. After losing my third child, I truly believed that I was having a crisis, right? I had significant PTSD symptoms. So the words crazy and nervous breakdown are kind of layperson's terms with likely a mental health diagnosis underneath them. And so the first step would be to actually see a mental health professional and see, do you meet criteria for depression, for anxiety, for PTSD? And in that, is it important to have a diagnosis? No. But having a diagnosis opens up a door to treatment options, antidepressant treatment options. There's things that we can do for anxiety, right? Because remember, the hidden symptoms of grief, it has impacted you in a mental health way. And so now there's a mental health concern that needs to be addressed and treated. And yes, working through that grief and trauma could heal this feeling of feeling crazy or having a nervous breakdown, depression, anxiety, PTSD. However, it's really hard when these mental health symptoms are there to turn that around in the midst, right? Like if I said to you, okay, do this, this, and this, and make sure you're exercising and eating right. If you're depressed and feeling like chaos in your brain, you don't have the energy for that. So it is important to not use the words crazy and nervous breakdown, but get a diagnosis and look at treatment options for that diagnosis so that you can begin to work on that grief and trauma. Next question is, I have really bad migraines ever since my husband passed away. I never had them before, but they do run in my family. I asked the doctor if it was from grief, and they said not really. So both are true, right? Like Western medical doctors are trained in symptoms and diagnoses, right? Functional medicine doctors, integrated medicine doctors, and are kind of trained in the whole body. You still need to go to the doctor, get your diagnosis, take medicine that you may need to take. But I also want you to look at this from a emotional, mental, and maybe even spiritual view, reframing it, right? If you look at energy work, energy practitioners from Reiki to quantum physics to psychic mediums and things like that, they talk about these physical manifestations being a spiritual problem, right? Knowing who you are in your soul. And so there's multiple levels of this, the spiritual level, the mental level, and the physical level. And you have a physical manifestation. And there's medications that we can use for migraines. And if you are having severe migraines and they're very painful and there's a preventative med that you can take that's working, do that. But also be working on, processing this grief. And processing grief is coming to a point of cherishing the relationship that you had. There is no way that I would go before God 30 years ago and not say yes to having my children and having my experience. And so that is my spiritual healing that has occurred. And that is the cherishing the pain of the grief. When I am missing Maya and Reggie and Johnny and my husband, we call Bundy, I can sit in that pain, but with contentment and peace. When it's enmeshed with my trauma, it feels like chaos, it feels horrible. And so again, learning to separate that grief and trauma, but also getting treatment for the migraines. The last question is, I have a similar story to you. I have multiple little symptoms. The doctors are actually saying that there's nothing seriously wrong with me, but I am fatigued. I am having trouble, getting up and exercising, going to work. There's two things here. One is giving yourself grace. Giving yourself grace that traumatic grief, trauma and grief, intense grief of losing a child, a husband, someone dear to you, is a heaviness, is a weight. It is like carrying around a weighted vest. And right now, that weighted vest might feel like 100 pounds. But if you begin this process of understanding your grief, processing, releasing your trauma, that 100-pound vest will get lighter. We may always carry that vest, and we have to adjust our life to that new heaviness. But if it is getting more heavy over time, you're doing something to make it heavier unconsciously, maybe feeding into the negative thoughts, right? Negative thoughts come from your trauma, not from your grief. And so again, I've said it 100 times, I'll continue to say it, separating that grief and trauma, learning to speak lovingly to yourself, working through that spiritual conflict, and allowing your body to begin healing. So having grace that this thing weighs 100 pounds, but also what can you do to get it to feel like 95 pounds, 90 pounds? I think oftentimes when we give mental health advice, we give this all or nothing. Well, do these 3 things and you'll be able to take off this vest forever. And that has not been my experience. But I can slowly decrease the heaviness of that, right? And then you feel a little physically better, a little mentally better, right? Just a little bit over time. I believe that you can do it. I want you guys to watch this next video about disappearing and reinventing yourself. And I'm not talking about running away, but disappearing emotionally, like to take care of yourself. And you can also do that through our Grief Intensive. Watch the next video, click the link below, start your journey today.